What is BPH? As men age, they may experience benign prostatic hyperplasia, or BPH, which is the term used for a growing prostate. When the prostate gland enlarges, it puts pressure on the urethra. The urethra runs right through the middle of your prostate gland, so when the urethra is constricted or obstructed, a man can begin to experience lower urinary tract symptoms. These symptoms may include getting up at night more often to urinate, not being able to empty your bladder, weaker stream, or sometimes frequency and urgency. There are two procedures that your physician can perform to help improve your urinary issues: a transurethral resection of the prostate, or TURP, and a Greenlight laser procedure. What is a TURP? A transurethral resection of the prostate, better known as a TURP, is the traditional way to open up the prostate gland and reduce the obstruction of the urethra. During the TURP, a resectoscope is inserted through the tip of the penis and into the urethra and is used to trim away excess prostate tissue that is blocking urine flow. The resectoscope has an electrical loop on the end of it which not only helps cut away tissue, but also helps cauterize tissue, reducing the amount of bleeding. The tissue that is removed can be sent to a pathologist who can then examine the tissue to determine if there are any cancer cells in the prostate gland. What is the Greenlight laser procedure? The Greenlight laser procedure is another option in the treatment of BPH. Unlike TURP, this procedure uses high-powered laser light combined with fiber optics to vaporize the overgrowth of prostate cells. Many patients choose Greenlight because of its simplicity and efficiency. Greenlight also has minimal bleeding because the laser frequency actually seals blood vessels. One difference between Greenlight and TURP is that with Greenlight, your physician cannot collect any tissue samples because the tissue is literally vaporized. In some cases, bleeding may occur during the Greenlight procedure. If this happens, your physician may convert to the TURP method because it's better at controlling bleeding. Only 5% of patients who start out with a Greenlight procedure may end up being converted to a TURP. It's important to know that changing the type of procedure in the middle of the surgery is not considered a complication. Each procedure has its own advantages for getting the best results. Preparing for both procedures. Both procedures generally take about 30 to 60 minutes to perform. You will be given general anesthesia and prescribed antibiotics to prevent infection. Several days prior to surgery, you must not take any medications that may increase your risk of bleeding, like blood thinners or pain relievers like aspirin or ibuprofen. Like any surgery, do not eat or drink anything after midnight the night before your surgery. And since you will be sedated, you will need to arrange for someone to pick you up after the procedure. Risks and side effects. Both TURP and Greenlight are safe and effective procedures that offer short recovery times, generally good results, and few long-term side effects. Patients usually experience improvement in their urine flow and associated symptoms. You may leave the hospital with a catheter, which we will remove once you are able to urinate on your own, which is typically 3 to 5 days after surgery. Strenuous activity, constipation, and sexual activity should be avoided for about 4 to 6 weeks. Symptoms such as frequent urination and burning will continue for a while because of irritation and inflammation caused by the surgery, but that should ease up during the first 6 weeks. You may also experience some bleeding. This is normal. However, if the bleeding becomes heavy or you develop a fever of over 101 degrees, call your physician immediately. As with any surgery, there can be side effects. The most common side effect a patient may experience is retrograde ejaculation or diminished ejaculatory volume, neither of which affects orgasm or sexual pleasure. There is also a small risk of urinary incontinence or leakage. Some men may require follow-up treatment because their symptoms may return over time or never adequately improve. Your urologist and clinical staff will answer any of your questions and provide further information to help you decide if these procedures are appropriate for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.